Any questions about these ladies' presentations? Yes?
The efficacy of Nutrasol and Sterisol, or essentially, so we could say it's about a year or so, right?
It's permanent. Or we haven't had dogs that died of old age yet, but it appears to be permanent.
It is permanent, okay. And how does it compare to calcium chloride? Is calcium chloride permanent as well?
I don't think any of these individuals has a detailed or close contact or information on calcium chloride, so I would suggest asking Dr. Jana, who prepared the poster up here, perhaps during the lunch break.
Okay, and one last question. Why did this country, the FDA, remove Sterisol 2 years later after it was introduced and just effectively did?
It was the FDA has not withdrawn approval for for Nutrasol. The Nutrasol is FDA approved in the U.S. today, but there is not a company marketing and distributing Nutrasol in the U.S. today. So it wasn't taken off the market because of a problem with the drug or with its regulatory approval, but because of a business decision to no longer continue to market it through the company that was doing it then. Yes, ma'am.
Julie, can you give us some more detail on the improper injection technique that was then changed with the Nutrasol, please?
That's a good question, and I actually am probably not the best person to talk about what was done after we learned some lessons. I think this afternoon we'll hear more about injection technique, but one thing that's really clear is that any of that substance leaks out onto the skin or towards the outside of the testicle, and it's very caustic. It doesn't appear to be caustic, but it's in the testicular parenchyma. And so one thing that has been changed, at least for some groups, is they change the needle after they draw up the drug, which when you draw it up, it's going to leave some residue on the needle. So if you change the needle, you have both a sharp needle and a clean needle to use. To be, I saw the 5-second injection time slower than we did, so there'd be less pressure for it to leak out. But probably somebody who's been recently trained would have better tips than that.
I think that probably the main one is the change of the hub of the needle, and there is a recommendation for sedation for these dogs. So I'll have to let Dr. Escobar and the others from Mark Sciences maybe comment on that further. But for us, we absolutely believe that having these dogs as immobile as possible will at least help us, because if they're moving, when you've got a hub of a needle, you've got a needle in their testicle, well, it's more likely that needle is going to start moving away and move into that scrotal tissue and away from the testicles.
My understanding is that the recommendation for sedation is much more for keeping the animal still and for the veterinarian's comfort than it is because of pain. Some people assume that, if it's recommended to sedate them, it must be painful. It's actually, you need the animal to be holding still. So if you've got an intractable animal,
Julie, you mentioned that the scrotal ablation in the cases of the severe side effects was quite difficult. Can you tell us a bit more about how that is done? Are there written protocols on how to deal with that? Would a vet need additional training to deal with scrotal ablation? Because I'm a little bit concerned that some groups are taking on the grant to use the Sterisol and they don't realise the follow-up, this safety net we talk about, that they're going to need to perform in maybe 0.5 to 1% of cases.
And this is something I think is very important, whether you're doing chemical surgery or traditional surgery to sterilize animals, is we need to be able to take care of complications, and it is far more difficult as a surgeon to treat a complication than it ever is to do the routine surgery. And a scrotal ablation is essentially removal of the entire scrotum and the testicles, and that can be in healthy tissue. It's not that big a deal, but in tissue where you've got necrotic tracts spreading away from the injection site, it required some pretty advanced surgery. I'm not sure that I would have done a good job at it. They had a board-certified surgeon by chance on the 17 team, and they're much more comfortable doing that with the flaps around disclose the decision. So it shouldn't be taken lightly, which is why it's so important that this training be a big feature of releasing the drug. And I think it's a great step in responsibility for the company now to be controlling the distribution dependent on training. But still, it's not going to be 100% safe. So there needs to be some mechanism to treat a serious complication.
Just a clarification, does the training include providing a protocol or advisory training on scrotal ablation?
Oh, I would doubt it, but maybe when the rest of the art sciences team is up here later today, they can talk more about how they deal with that more extensive complications.
And that was our protocol that all of our veterinarians, before they went on into the field, had to review scrotal ablation so that they didn't have to do performing that if we had to do it.
We'll make sure that we discuss that later when we have the art sciences folks up here. Yes, Bob?
I think it's important to note that scrotal ablation may be necessary post-routine castration. A large dog with a pendulous scrotum may develop a hematoma that potentially get infected that would require scrotal ablation as well. So even if you're doing surgical sterilization, it would probably behoove you to at least be up on that procedure, because you may be called on to do it regardless of whether you're using injectable or surgical techniques.
I might as well, clean standard procedure when castration is going to have potential outcome. A lot of times you get scrotum disorders out of the soft and it's really good signs because they're painful and potential infection. So, other questions I have for Judy, the complications, were you guys using NSAIDs as sort of pain control after the procedure in that particular?
Good question. The question was whether we were doing NSAIDs or pain control after, and I would say it was inconsistent. When we went down there, we didn't really have any experience. Well, we had zero experience. So we didn't know what to expect. We were told it was completely painless and that we should not expect pain. We did notice tenderness and swelling, and so we started using carprofen. We had injectable carprofen with us, so all of our surgical animals and a lot of the neuter animals got it, but it was inconsistent. We also didn't have a plan for doing very intensive monitoring, which we realized on the fly that we needed. So as the program progressed, we started doing day checkups on the dog. We went to the houses and checked on the dogs the next day.
Thank you all for the question needed. You chose steatoprofen as your NSAID. I was wondering the reasons for that versus others.
Actually, one of our main policies with best headquarters is to try to use locally available drugs. So ketoprofen is a locally available NSAID that we could use.
So I guess the reason I was asking the question is because ketoprofen of all the NSAIDs we have available in the United States is probably the highest amount of complications. So just for the reason it's not.
Ludush and then Mr.
Yeah, I really want to know what is the effect on after administration of estrogen. That's what we have to be careful of.
So what did you tell the owners of the dogs to look out for after the procedure? Is that
Yeah.
understanding?
You were doing straight, right? So we had specific written instructions of what to watch for. Because they'd received sedation, we discussed how much they should or should not eat that evening, what they should watch for as far as appetite. So general post-surgical, even though they weren't receiving surgery. We asked them to look for swelling and pain, and any oozing or anything that they might be able to see. And then, very importantly, is we left them a telephone number for them to reach us. And then we contacted, if we hadn't heard from them, we contacted them 3 days later.
Yeah.
I think one of the one thing that we really wanted the client to be looking out for was any sign of irritation. So we might have used the ketoprofen as whether we use it for pain or anti-inflammatory. My understanding of the Stericycle is that you want to eliminate anything that's going to trigger irritation, anything that's going to make the dog want to start licking and chew off the scrotum. So if a dog starts licking at the scrotum, we want to know about it. If he is looking at it, or if he's off his food, or anything
slight indication. This is our first big project, and we were going to be leaving, and you know, we wanted to make sure that we got every animal before we left, so that clients did not have issues. So, was it red? Was it warm to touch? Was it swollen? Was it changing color? These were all written out for them. Do you have any concerns?
That you get the report that they swear, what are you going to do immediately?
What did we do immediately? We went to see the dog. And we were there physically in order to do so. That was part of our protocol. We were available to go examine these dogs and treat them if necessary. Just like we would do if we were doing any surgical procedure, and I think that's important to say, that this is no different in respect to the kind of post-operative care you need for surgery versus this kind of injection. You need to be available.
If you had concerning your procedure lately, retrospectively, would you consider, besides setting the homeless analgesia, setting the homeless and sedatives?
Sedatives, I think, I'm not sure that would really stop licking. I might send home with an e-collar, although it would have been funny to see e-collars all over Isabella. But I'm not sure that sedatives would really overcome their urge to lick it if it was tender or itchy.
And I think in some of these communities, you know, some people are highly educated and others are not. And I didn't mention this, but most people in Todos Santos are illiterate. You know, to give them medications to give at home has got its own risk factors. So we were very careful about whether that was done or not. And I think it's something that you need to consider when you're working with these communities.
And just to clarify, you guys were giving an injection, a longer-acting injection of an anti-inflammatory, not anti-inflammatory, so it's not giving pills that have to be given.
We did give the injection, but I will add that if we did hear and we did see in some cases that they were painful the day after or 2 days after, we were giving them the medications with strict, you know, we were giving them oral anti-inflammatories that we had available for them. So it sometimes did include oral anti-inflammatories, but on the average dog, it was just the injection.
That was similar in the Galapagos. Also, when we observed problems, we would either distribute antibiotics and anti-inflammatories at home, or very often when we became concerned about the complications, we actually brought the vet dogs back up and housed them at the clinic and treated them ourselves.
So with the follow-up, given you work in situations where, and I forgot to say this as well, communities that she's worked in, that many of the human population was illiterate, then how did you manage communicating what to look out for?
We verbally went through the discharge information and the consent forms as well.
So you had someone who's fluent in the
Yes,
local
always.
Spanish.
Exactly, we did this demonstrating everything with the person there, and sometimes many family members there as well, so that everybody was watching and everybody knew what to do.
I remember you also saying before, Emma, that it was often the children that would be, the family that would be bringing in the pets, and would also be the ones that would see if there was a problem afterward. Yes,
I wanted to know if you remember the number of the needles you were using.
The gauge.
25
25 and 28.
But that's
the
not,
question was what gauge needles were used for the injection.
and 1.5 each.
It's recommended, I believe, you be prepared with both 1/2 inch and 1 inch, and at least 25 gauge, if not longer. And then you choose but we'll get into that in a little more detail in the afternoon. You choose the needle that's most appropriate for this.
What I'm saying is that we're using the same needle that we're using now, so that's not, that is different, because we're using at 26, you know?
Oh, so you want to, Julie, what size did you guys use?
We used 25s to 27s, and we had a range of 1-inch needles to 1.5-inch needles, because you do have to get the injection into the center of the testicle, and on the bigger dogs, it's...
So it's practically the same.
Well, but the difference was that they were changing the hub of the needle between testicles.
It's a new needle.
Yeah. So there's a new needle.
Right, we did not change the needles on our...
So it's the same needle, only that you didn't change it between, like taking out the
Right.
have Philip, and then we'll see where we are. We'll talk about oh, Carlos has a response, I believe, to that question. Jump in, Carlos.
Okay, thank you. In addition, I would like to give you 3 comments. First of all, about the question of lesions, surgical training. We are not giving this type of training because we are working with veterinarians, so it's very difficult to establish an only international standard about the correct surgical technique. In these cases, all the books about the surgery and all the veterinarians have their own surgery protocol for these cases. We are only discussing that just in case of present these revelations, obviously they need to proceed with this type of surgical techniques. The second comment is about the distribution, because at least in Mexico, the regulatory agencies consider that Sterisol is a controlled pharmaceutical drug. So that means that an official requirement, nobody can get the product after they get the correct training and prove that they have all the knowledge in terms of injection techniques. So it's a very good advantage for us because we can make sure how the doctors are working using studies on there, and on the other side we will be able to have a very good contact with them and following up what is happening with them. And finally, about the pain or the swelling, we are proposing to conduct more studies to see how we can measure the pain. We know as a doctors some clinical signs to see if the patient is under pain, but sometimes, in some cases, we receive information, for example, the pet owner, hey doctor, my dog is in pain. Why? Because I see him, he's in pain. Okay, the question is your dog moving? Yes, absolutely, he's jumping. So somebody will be able to explain me how with pain the dog can move. So we have another proposal. The chart for children, you know, in the human hospitals, they have a chart with 10 different levels to establish what kind or type of pain the child can present during the physical examination. In my own case, let me tell you that I'm working with the biggest important criminalist in the world. This guy was the guy that designed to talk and make the drug for a suspect. And in this case, we are working to establish and to get the definition for the changes of the dog faces besides the mydriatic clinical signs, the hypersalivation, the muscles, the contraction muscles on the face, to establish or try to make a research to put in different levels. And obviously we have a very serious evidence that this doctor has level number 2 of pain, so the medical protocol could be 1, 2, 3, whatever. And finally, swelling is very easy to confuse with big size testicles. It's not the same. To diagnose swelling, we need to establish 5 different points. One of these points, obviously, is the increase of the size. But the other 4, it's including pain, change of consistency, change of rumor, and change of color. And in the many of the cases that we received reports, we are receiving reports about swelling. We are asking to the clients for these different 5 points, and the only point that they can report us is only the increase of the size. Please remember that we are injecting an additional volume inside the testicles. So it's logical that the testicles will increase the size. Okay?
Makes sense. I wish that we could take some more questions now. It's time to break for lunch, but again, we're going to have an hour-and-a-half panel, and the second half of this afternoon that will be just focused just for Q&A, so that we can keep working through this stuff. Yes, Bruno?
Just one last question, is it possible? Because basically all the studies were done for overpopulation or population dynamic. We're talking more about the technique, but anything to say about the population? Did it increase after? Did it decrease? Did it help control the population of the island? I mean, correct?
In the Galapagos, on our poster, there is some data that you can look at on the graph. And our project and the other projects are combining staying of females as well. So it's very hard to isolate just the effect of using Nutrasol or Sterisol in the males, because we're also spaying the females in these programs.
And for our purpose, when we originally decided that we were going to go ahead with this project, we actually wanted to do just males, sheerly out of research interest. But we were not met by the community in a happy fashion with that. They really wanted to do their female dogs. So we felt it wasn't ethical for us to walk into that community and say, oh, we're just going to do your boys because that's what we want to find out about. Does that influence population control? So we couldn't. And I don't think it's right. But on the other hand, if you just look at the number of percentage of male dogs that we seem to be able to achieve with a Sterisol in comparison to some of the more other spay neuter facility, programs that are out there doing male dogs, we may not be focusing on them, but the percentage is much higher using a Sterisol so far.
I want to, well, actually, I'll say a couple closing things before we thank our panels, because then that's a nice way to go off. So we go to lunch right now, which is in the room next door, and we're going to have a lovely lunch and a presentation by Gregory Castle from Best Friends Animal Society, who's one of our sponsors. And Best Friends is also sponsoring, going to be sponsoring 20 of our Sterisol grants. I'm not going to know this. And then we come back in here at 2, and we'll be doing the administration training and the demonstration of the injections. Have a break, and then we'll have the Q&A panel after that. I want to invite you to join me in thanking our panelists.